Okay, so you know how sometimes you see a kid flapping their hands and it's like, what's going on there?
Yeah,
Well, today we are diving deep into hand flapping in children
absolutely.
and why it's so important to understand what's behind it.
Right.
We're going to be looking at two really interesting sources today.
Okay.
One is a conversation between two ABA therapists, Sarah and Jake,
Mm-hmm.
just kind of chatting after a workshop they were at.
Right.
And then also this book, The Ultimate Guide to Hand Flapping.
Yeah, very interesting stuff. What I found fascinating is how both of these sources really emphasize
Yeah.
that before you even think about, like, addressing hand flapping,
Mm-hmm.
you have to understand why it's happening in the first place.
Right.
It's not just about making it stop.
Yeah, it's not like, don't do that. It's like, okay, what are you trying to tell me?
Exactly. It's like solving a mystery. You need to, like, find the clues before you can solve it.
Right, like is the child trying to tell us they're excited, or are they overwhelmed, are they anxious?
Exactly. You got to figure out, like, the function of the behavior, not just see it as a problem.
Right.
And that's where ABA therapy comes in,
Okay.
applied behavior analysis.
Mm-hmm.
It's not about, like, suppressing those hand flaps. It's more about figuring out, okay, what need is this meeting for this specific child?
Okay.
And then how can we teach them alternative ways to meet that need?
That makes a lot more sense. So instead of just saying, don't do that, it's like, okay, what are you trying to communicate, and how can we give you other tools to express yourself?
Exactly,
Right.
exactly.
Mm-hmm.
And one of the tools that both sources talk about is functional communication training.
Okay.
So let's say a child flaps their hands when they're feeling overwhelmed by noise,
Mm-hmm.
like they're in a busy store or something.
Oh, yeah.
Instead of just, telling them to stop, you could teach them to say, too loud,
Right.
or even use a picture card if they're nonverbal
Okay.
to communicate that discomfort.
So we're giving them a voice.
Exactly.
Literally.
Yes.
They're learning to express their needs in a way that other people can understand, which has to be so empowering for a child.
It is. It is. It helps the child feel heard,
Yeah.
but it also helps those around them respond in a more supportive way.
Right.
And then when it comes to actually reducing hand flapping, the ultimate guide goes into some specific ABA techniques that can be helpful. So you've got, positive reinforcement,
Mm-hmm.
which is pretty straightforward, rewarding the behaviors you want to see more of. But then there's this other technique called differential reinforcement,
Okay.
which I find really fascinating.
I'll admit that one sounds a little intimidating. Can you break that down for us? What is that?
It's actually pretty simple,
Okay.
but incredibly effective.
Okay.
Basically, instead of focusing on decreasing the hand flapping directly,
Okay.
you reward any other behavior the child does besides flapping their hands.
Okay, so it's like they're flapping their hands and then they stop and they like start playing with a toy. You would reward that.
Exactly.
Oh.
You're kind of subtly shifting their attention and reinforcing those alternative behaviors.
Gotcha.
Think of it this way, like if you constantly tell a child, don't shout,
Right.
they're still focused on shouting.
Yeah.
But if you praise them every time they use their inside voice,
Right. Right.
you're reinforcing the behavior you want to see more of,
Totally.
and they're more likely to repeat it.
That makes a lot more sense. So it's about, again, focusing on the positive and
Exactly.
giving them alternatives, not just shutting down the thing that you don't want to see.
Exactly. Exactly. And the guide gives some really compelling examples of how this can work in real-life situations.
Okay.
But one technique that really stood out to me is this idea of gradual desensitization.
Okay.
So let's say a child tends to flap their hands in really crowded, noisy environments.
Oh, man, I can relate to that. Sensory overload is real,
Right.
even as an adult.
Right. So instead of, avoiding those situations altogether,
Right.
which can be limiting,
Right.
gradual desensitization involves slowly and gradually
Okay.
increasing the child's exposure to the trigger,
Mm-hmm.
in this case, the noise and crowds,
Right.
while also teaching them calming techniques.
So it's like dipping your toes in the water before you jump in the deep end.
Exactly.
Okay.
We're helping them kind of build up that tolerance over time
Mm.
in a really safe and controlled environment. So maybe you start with like short exposures to a
Yeah.
less crowded place,
Okay.
and you gradually increase the time and the number of people as the child becomes more comfortable.
Mm-hmm.
And while you're doing that, you're teaching them those coping mechanisms like Maybe some deep breathing exercises or using a weighted lap pad.
Okay, that makes a lot of sense. And I love that it's not about forcing the child to just deal with it, but it's like you're giving them the tools and the support to
Yeah.
navigate those situations.
And the guide emphasizes that this has to be individualized.
Oh, for sure.
What works for one child might not work for another.
Of course.
So it's a lot of observation, patience,
right.
and working really closely with the child and their caregivers to find the right pace and the right approach.
That makes me think about something that Sarah, the therapist, was talking about in that conversation, which is about the importance of a structured routine.
Yes.
Is that connected to this idea of gradual desensitization?
It really is. It's like, if you know what's coming next,
Right.
it's a lot easier to manage those situations that might feel overwhelming, especially for kids who maybe have a harder time with transitions or unexpected changes.
Right, right. Like routine kind of equals that predictability,
Yeah.
which then reduces the
Right.
anxiety, which then might reduce the need to hand flap as like a coping mechanism.
Exactly.
It's all connected.
It is. It is. And, when we're talking about routine, we're not talking about a military-style schedule or anything like that. It's
Right.
more about just creating a sense of predictable flow to the day.
Okay.
And Sarah was talking about using visual schedules with kids.
Oh, yeah.
So using pictures
Oh, right.
to represent different activities like
Right.
getting dressed, having breakfast, playtime, that kind of thing.
It's like a little picture book of their day.
Exactly.
Which I kind of love. That's a cute idea. It
Yeah.
makes it very clear. And like you said, less overwhelming because you can see it. It's not just this amorphous blob of what are we doing?
Right. And it's not just for kids. I mean, even as adults.
Oh, for sure.
I know I feel more grounded when I have a routine. I know what to expect.
Oh, absolutely. Yeah. Routine is my jam. I'm all about it.
Right. Structure is good.
Yes.
And the guide also emphasizes that, these routines shouldn't be imposed on the child.
Right.
It's about working with them,
Right.
understanding their preferences, understanding their needs, and building a routine that really supports their
Right.
individual strengths and challenges.
And speaking of support, we talked about sensory breaks a little bit earlier.
Yes.
But I want to kind of dive into those a little more because Sarah seemed to think that those were super crucial, not just for the kids, but even for the adults in their lives. Why are those so important?
Well, because we all have our limits
That's true.
when it comes to sensory input.
Right.
And it's just like those routines we were just talking about, sensory breaks are all about creating
Right, that-
predictability and a sense of control
Right.
in a world that can often feel unpredictable, especially for a child who might, process sensory information differently.
It's like hitting the reset button when it all just gets to be too much.
Exactly. And it's not about avoiding sensory input altogether. It's about giving the child the tools and the space to regulate their own sensory experience.
Okay.
And this is where the guide talks about this idea of creating a sensory toolkit.
Ooh. Okay. What's in the toolkit? Tell me everything. I want to know what I would put in a sensory toolkit.
It's all about personalization, of course,
Mhm.
but think about things that provide different types of sensory input.
Okay.
So, a lot of kids find deep pressure to be really calming.
Right?
So things like weighted blankets,
Yeah.
weighted lap pads could be great for that. Noise-canceling headphones,
Yes.
if they're feeling overwhelmed by noise, that can create a sense of quiet and focus.
Right?
Fidget toys
Yes.
can be great for kids who just need to move their bodies.
Right.
It gives them a way to channel that need
Mm.
in a more contained way.
It's like you're building a little oasis of calm
Yes.
that they can carry with them.
Exactly. And the guide stresses that it's really important to involve the child in this process.
Oh, of course.
Ask them what feels good, what helps you relax.
Yeah.
And then it becomes less of a clinical intervention and more like, these are my special calming tools.
Right.
These are the things that help me feel good.
Which makes it more empowering for them
Yes.
because they're not just being told, you need this. It's more like, I have these things I can use when I'm feeling overwhelmed.
Exactly.
And I can advocate for myself and say, I need to use my tools right now.
Yes.
Yes.
It helps build that self-awareness and self-advocacy,
Right.
which are such valuable life skills.
Absolutely. For everybody. And it's interesting because it seems like everything we're talking about, from those ABA techniques to the routine to the sensory breaks, it's really about giving children the tools to kind of understand and manage their experience in a world
Yes.
that isn't always designed with their needs in mind.
That's a really good way to put it.
Yeah.
It's about creating a more inclusive and supportive environment,
Right.
both, at home and in the wider world.
Hmm.
And that kind of brings us to something else
Let's.
that both of our sources really emphasize,
Okay.
which is the importance of parents and caregivers
Right.
managing their own stress levels.
Right. Because Sarah made a point of telling Jake, like, don't forget to take care of yourself too.
Yes.
And even the guide dedicates a whole section to this. So why is that so crucial? Why is it so important that we as the adults in these kids' lives are managing our own stress? How does that tie back to everything we've been talking about?
Well, it's like, you can't pour from an empty cup.
Right.
If we're the adults in these kids' lives and we are burned out and stressed.
Yeah. How are we supposed to create this calm, supportive environment that these kids really need?
It's such a good point, and it's something that I think so often gets overlooked.
Yeah.
Because the reality is when we're stressed,
Right.
our ability to think clearly, to respond patiently,
Oh, yeah.
to even just be present,
Totally.
it takes a hit.
Yeah, I know for me, I am a million times more likely to lose my patience with my nephew after I've had a really chaotic day at work or something.
Right.
And that's just adult to adult, so I can only imagine how much more amplified it is for a child who's maybe already struggling with sensory overload or anxiety.
Absolutely. And what's fascinating is that the guide actually talks about how children, especially those on the autism spectrum, they're incredibly tuned in to our emotional states. Wow.
Even if they can't articulate it, they can sense when we're feeling stressed or frazzled.
So it's almost like their hand flapping could actually be a reaction to our energy.
Yes.
Not even just something that's going on in their own little world.
Exactly. Exactly. It's like they're a mirror reflecting back our own emotional state, which isn't to say it's our fault
Right.
if they're struggling,
Right.
but it does highlight how important it is
Yeah.
for us to really prioritize our own well-being
Right.
if we want to support them effectively.
It's like that thing they say on airplanes, like put your own oxygen mask on first
Exactly.
before you help anybody else. Because if you're,
Yes.
gasping for air, you can't help anybody. Exactly. And that's a message that I think Sarah really drove home in that conversation with Jake. She was just like, self-care is not selfish.
Right.
It is essential.
Yeah.
And it doesn't have to be complicated. It could be as simple as, taking 5 minutes to do some deep breathing exercises, listening to a calming song, or just stepping away from a situation for a moment to kind of regroup and collect yourself.
Give yourself permission to take a break.
Yes.
Recharge so that you can show up as the best version of yourself
Exactly.
for the people who depend on you.
And I love that both sources also emphasize that seeking support is not a weakness.
Right.
It's a sign of strength.
Totally.
Whether that's, therapy or a support group, or even just, talking to a trusted friend. It's okay to ask for help when you need it.
It's interesting how we started this whole deep dive with something that seems so external, like, a child flapping their hands. But it's really about understanding this whole picture,
Yeah.
the child's internal world and the environment that we create around them.
It's about connection, empathy.
Yes.
Both for the child and for ourselves.
Yeah.
Recognizing we're all kind of in this together.
Yeah.
Navigating the ups and downs, learning and growing along the way.
And sometimes it's those seemingly small behaviors,
Right.
like flapping hands,
Yes.
that can spark the most profound insights.
Absolutely.
If we're willing to just kind of look a little deeper.
It's a good reminder that, all behavior is communication.
That's true.
And our job as, parents, caregivers, fellow humans, is to listen.
Yes.
With open hearts and open minds.
Beautifully said. Well, on that note, keep those brains curious and those hearts open. We'll see you next time.